How do you see the evolution of interventional neuroradiology? How is it today, and where do you see it going?
Well, we did not stop, but we changed some quite in during this year and a half, especially during the first months of 2020, because we could not do any program patients. We only could do emergencies, so we changed quite a bit. And but for the evolution, the stroke has been really a big evolution on our field.
And how do you see, can you describe a little of, for you, how that evolution is taking place?
In stroke, more and more companies and industry are developing devices. At the beginning we have one or two devices, now we have a lot of devices, and quite very good, even better and better, and the competition between industry, it's very good because it makes it appear better devices, and when we have better devices and we have the knowledge, we can treat more and more patients. And
right, I would imagine that the experience, that the increasing experience also allows you to point industry to where you want those devices to go.
Yes, of course. They ask us what we would like to have, and we proposed also, and we shared this knowledge and our difficulties, and how we can pass to resolve the difficulties.
Is there a particular unmet need that you're looking to fill now in these devices or in your practice?
Well, in stroke we have still some strokes, some clots that keep on coming up, and we cannot take off, and we don't really know why. And more distal clots, and clots are different, and sometimes we cannot reach, but it's less and less the matter that we cannot take off the clot. So it was a big evolution in stroke.
How is that affected? Well, Portugal's not that large a country, but is it easy to get the patient who has a stroke to the centers that are trained to treat it?
Yes, in big towns, yes. More in more periphery, it's quite still a problem. And for stroke, it's still a problem, the transportation. What we wanted to be better developed is the transportation of the patient, because when you arrive to the hospital, everything is already almost. It can be also always be better, but it's already in a certain good point. But still, transportation is a problem, and to deal with periphery centers that have the knowledge to do it, or to concentrate in big stroke centers and have the good transportation. This is an equilibrium that it's not very easy to reach.
Imagine somebody has a stroke and in a rural area. What happens then? Are the teams in a rural area prepared to treat that patient, or would the future something with artificial intelligence, or is there something that could help them? Do they give their patient medicine? What do they do?
The IA, it will be a big field, and they'll come to stay, and it's good to help us. And we have to keep on going with the IA. For now, for our way of the treating, well, we saw this today, the robotic, it will maybe help us in the future, and in the very farthest places, as they give the example of today.
Okay. Is there any other last statements you want to make about stroke, or anything else for the LINNC audience?
Well, I hope a stroke treatment could be to everybody, wherever people live. And and to keep on going with neurologists and to see if we can change some maybe guidelines, because less selection maybe for the treatment is the best way to give treatment to most of the people that have a large facial occlusion, even knowing that there are some patients that they are not in the criteria, but maybe we can enlarge the criteria to treat more patients.
Well, thank you very much for being with us.
Thank you. Thank you.